Welcome and thanks for taking the time to speak with me today. Would you guys mind giving a brief introduction and then we can dive into questions?
I'm Sonja Rasmussen. I'm a pediatrician and a professor at the University of Florida in the departments of pediatrics and epidemiology.
And my name is Lindsay Thompson. I'm also a pediatrician and a general pediatrician, also a professor of pediatrics and health outcomes and biomedical informatics at the University of Florida.
All right, thank you for that. And now just for a bit more context for our audience, Dr. Rasmussen and Dr. Thompson are the authors of a recent JAMA Pediatrics article titled Coronavirus Disease 2019 in Children, What Pediatric Healthcare Clinicians Need to Know. And so I guess the first question, what would be the biggest takeaways you want pediatricians to have from your recent article?
Well, I think what we're learning from the data from China and early data from the United States is that it seems like kids are less severely affected with COVID-19 compared to older persons, to adults. They have a lower level of getting sick and a lower level of dying, being hospitalized and dying. But that doesn't mean that they don't get sick at all. And there are some kids that have gotten very sick and there have been some deaths. We also know that kids are getting infected and they could possibly be spreading it to adults.
All right, and now obviously you touched on it, some kids are still getting sick, even though it seems like we're hearing mostly that kids are basically being spared from this virus in comparison to older generations. What are some of the highest risk patients among pediatrics?
Well, we don't have a ton of data right now. We do have suggestions that kids who have underlying conditions may be at higher risk, but the amount of data that we have right now is still pretty limited. Kids with lung disease, heart disease, other kinds of things, immunosuppression, those are the things that certainly we've seen in adults, and we'd expect kids to be similar. And there are some early data that show that, but we don't have a lot of information right now. So we're still waiting to collect more.
All right, and now what is sort of the state of concern among parents? And then sort of a second part of that question, what is the state of concern among pediatricians surrounding this outbreak?
I think I'm going to let Dr. Thompson answer that since she's been talking with a lot more patients than I have been.
Sure. Parents, like all of us, are worried overall. I think all of our populations are at risk. They're worried about their children, as parents seem to do best, because like Dr. Rasmussen was saying, children are still getting sick. They're also worried about the children who might not show that they're getting sick and could infect other family members. Many adults live or work closely with their own parents as well as having children. So a lot of families feel triangulated. They don't know who best to protect. So I think everybody is worried, that understanding that social isolation is the best thing to do, but it's very hard to do with most families.
All right. Yeah, it seems that social isolation is the big message just about for everybody these days. And now just staying on the topic of discussing with parents, what are some of the key points that you think it's important for pediatricians to hit on when discussing the COVID-19 outbreak among concerned parents?
I think it's the only conversation any of us are having now. I mean, parents are understandably really concerned, and I think by now we've all heard the basic message: social distancing, social isolation, social quarantining if you or your child starts to show signs of illness. Wash hands, cover your mouth, cover your cough with your elbow. Some really basic but really important public health measures are our best route right now. I think people are understanding how to clean surfaces, how to share a kitchen, even if somebody is getting sick with an illness or what could ultimately be COVID, that people just have to be very diligent and careful. And I'm trying to give that message to families that I work with, that we'll get through this, but we have to go through this really special time of being extra careful.
All right, thank you for that. And now I'm sure you could give us some insight on this next one as well. How is the outbreak impacting outpatient pediatric or family medicine practices?
You know, like everything about this outbreak, everything is different. Our practice at the University of Florida, like all the practices that my colleagues have told me have happened for them, we've almost all exclusively changed to telemedicine visits. We still do have in-person visits when indicated, but the majority of our work has gone from being extremely hands-on and face-to-face in exam rooms with families to doing that through Zoom and other applications, so that we can see children and families, but reassure them by distancing. We still do see families in our clinics. We see children who need to be evaluated if they're sick. And we also, following the American Academy of Pediatrics guidelines, we are still doing select well child exams, well child checks, because it's really important that children are still monitored for their growth and development, and that they still receive the needed screening and vaccines against other diseases, because with the healthcare system being so stressed, the last thing we want to do is inadvertently cause other illnesses to rise as we try to protect against COVID.
Okay, thank you for that. And now follows up nicely to your response. How is the use of telehealth and sort of this rapid onset of necessity to use telehealth been different for pediatricians compared to other fields?
It's different, but it's also very much the same. I think we're getting used to this platform pretty quickly. I grew up in the age of the Jetsons, and it was unheard of to think that you'd be watching somebody on TV and having a conversation, but that's our reality now. I think my colleagues and I have gotten very used to assessing children fairly well through telemedicine. I also work with trainees, with residents who are early adopters. They're uniformly enjoying this experience, knowing that they need to be distanced, but still can really connect with families. I actually think this will have a long-lasting legacy. I'm not the only one to think this way, that there will be a major change in medicine, even when this outbreak has settled and we really understand how to protect against COVID. I think telemedicine is here to stay. I think it'll have a very important role in certain populations, families that sometimes it's hard to get out of the house if you have a lot of children and maybe you don't have transportation, but maybe you do have a smartphone. So we can have interval visits, not replacing the important face-to-face time that you can have with families, but you can still create that really important doctor-patient relationship with telemedicine.
And I think I'm a specialist, a subspecialist, and I think we're really finding, we had some families that would have to drive 5 hours from the panhandle of Florida to get here to see us. And we're finding that they really appreciate the ability to not have to drive those 5 hours here and 5 hours back. So I think we won't go back to our old ways. I think we were seeing almost primarily kids in person, and I don't think I think when we can see kids by telemedicine, we'll be doing that in the future.
All right. And now, what are some of the other long-lasting effects you think we might see out of this pandemic on pediatrics?
Well, I hope that we're all going to wash our hands more. I mean, already hospitals are starting to see less spread of other disease because of the increased washing of hands. And I'm hoping that, this is what we would see if people didn't get their vaccines. I'm hoping people will see that vaccines really make a big difference, and how much we wish we had a vaccine now, how that could really change all our lives if there was a vaccine available now. I'm hoping that this will address some of the vaccine hesitancy that we've been seeing in families. I don't know, Lindsay, do you have other things?
I do think there, like the specifics that you were talking about, I think there's going to be a great appreciation for public health and its role in our communities going forward. And I just hope that we can hold on to the sense of community. I watch videos from New York of people cheering firefighters, cheering doctors, and doctors cheering firefighters, and people clapping on their porches. That's a unique moment that hopefully we can move forward. I'm an optimist. Not only do I think that our healthcare will change, but I'm hoping that our sense of community and wanting to protect the public good will continue.
Okay, and now I actually have a follow-up question I'm hoping you guys might be able to give a little bit of insight on. One of the things that we're hearing, especially I'm in New Jersey, and one of the big things that we keep hearing about is that numbers are lower, or numbers may actually appear lower because of lack of testing and things like that. One of the requirements in the earlier phases of testing was that you had to be a certain age and exhibiting symptoms. Is it possible that we know less about coronavirus in children just because we may not know how many kids actually contract it, but just may be asymptomatic?
Absolutely. Right now, we are really lacking a lot of information about how many kids are infected but don't show any symptoms at all. There's a recently approved test, an antibody test. So I think that antibody test that starts to be rolling out, and as more testing is generally available. I do think as we get through the peak of this disease throughout the country, we're going to have to think very carefully about how we slowly open the country back up. We can't just open the floodgates and expect that the disease isn't going to come back. The only way we can do that is to continue to do a lot of testing. And it's going to be testing of people who are asymptomatic too. So we're really going to have to think through this carefully to be sure that we don't just open things up and have a whole nother peak and have a lot of deaths and severe disease.
All right, and now just another follow-up question on that. Other than the apparent reduction in severity of the symptoms of the disease among children, is there anything else we know about the way COVID-19 might impact children differently than adults?
There was a paper from the CDC that came out yesterday, actually after our paper came out, and it does show that the symptoms are a little bit different. They're less frequently having a fever and other findings. So I think it is consistent with what we thought in our paper, and what we argued for in our paper is that there's probably more kids being affected than are known because of the lack of testing. I'm not sure about other things. I can't think of other things that are, I don't know.
Nor can I, but I think that same paper that came out yesterday from the CDC does show sort of an age, as age increases, the severity increases. We think of teenagers, and certainly they think of themselves as bulletproof. They're not going to get hurt by anything. And that's clearly not true. I worry about teenagers and their need for independence, and they may be just the population that we have to harness the most.
The other thing that paper showed is that young kids less than 1 year, are at increased risk too. So it's sort of the higher risk at the very young kids, and then you're starting to see kind of a U shape then going back up later on. So I think we really do have to worry about those teenagers that think nothing bad's going to ever happen to me. I need to get back out there and see my friends. So I think that's something we need to be considering.
All right, thank you for that. And now just lastly, was there anything else you wanted to touch on before I let you guys go? Is there anything you'd like to say to your colleagues during this time?
I think the biggest thing is that we have a lot more left to learn. I think any paper you're writing right now, you have to recognize that in a week or maybe in a couple days, there may be a lot more information, and it's really important to keep vigilant to the new information that's coming out. Keep your eyes on that CDC website because they are producing more information every day, and making sure that that information gets out to your patients and families.
No, I think that last part in particular, since this is our audience, our peers, that trying to digest all the information that's coming out is really difficult. So finding sites like the CDC site or perhaps your site here that helps people stay up to date, reassured, They know what to do the next day in practice. I've never had to make this many changes in my entire 20-year career than I have in the last month. So that kind of fatigue from so much change is real. So I think if people can find sites that they trust and return to, that will help sustain people's energy over this long haul.
And I do think this is something that Dr. Thompson talked about before, but I do think we need to keep in mind that we can't say, well, we won't worry about vaccines right now because we got bigger fish to fry. We know from certainly other outbreaks in other countries that when you do that, you end up with having outbreaks of other diseases later on. So we really need to keep our eye on the ball that there are kids that still right now, kids under the age of 2, I think is what the American Academy of Pediatrics is recommending, need to continue to be seen, need to continue to get their vaccines, or otherwise we're going to have more issues later on that we wouldn't have predicted related to COVID-19, but kind of the secondary consequences.
All right, and now just sort of a follow-up question on that, actually. How do you think sort of the mental impact of COVID-19 might influence the way younger parents make decisions regarding their kids now? Because obviously this has to be a very stressful time to be a parent. Do you think that it'll impact the thought processes going forward outside of maybe just opting to do a telemed visit instead of coming into the clinic?
We don't know. That's a really good question. And in fact, the content of a prior meeting that Dr. Rasmussen and I were on, we're trying to hopefully develop tools that we can guide families on how to make decisions going forward. We don't want it to be a trade-off. We want keeping families safe to be right in line with all the usual pediatric things that we do with vaccines, with growth and development. So I do fear that our whole country is having such worry, such mental health stress right now that I think a legitimate and ongoing concern will be how to keep everybody okay. You know, we've got children in the home for hours while parents, if they're lucky enough to be able to work from home, are trying to balance all of that and being homeschool teachers at the same time. We could really have a huge uptick in mental health issues, in child abuse and domestic violence that's already been seen and measured. So I think that, like Dr. Rasmussen was saying, that there's a lot of secondary negative outcomes that can happen if we don't remain vigilant. So I fear all those things happening, but if we can keep our communities positive and together, we can hopefully mitigate them.
All right. That was actually it, all my questions. Thank you guys again for taking the time to speak with me. I really appreciate it.
Thank you.